So as far as our practice, this is a picture here of our group. This is at Dr. Larson's retirement party. He started the practice in 1974, and he just retired here in November of this year after 45 years of service. So we are currently recruiting for a new urologist in our practice. So our scope, we cover pretty much the broad scope, adult pediatric urology. And as far as robotic surgery, I'm the only robotic surgeon in the region, so that's spanning from Denver, Colorado, all the way to Lincoln, Nebraska. So really have become a pretty large referral base, or robotic referral base for the region and some of the surrounding urologists that refer to us. So this is just a breakdown of our the urologists in Nebraska. It's, you can see here pretty heavy in Lincoln and Omaha compared to where we're at out here in Kearney, right in the middle there with 3 urologists. And so in terms of talking regarding the integration of healthcare, from a small group experience, in our area, all of us urologists, we're kind of separate in terms of our groups, but we all get along. We all have each other's cell phone. We're texting, calling regarding questions, trying to coordinate timely referrals, discussing difficult cases in terms of maybe which ones might be more appropriate for the academic center, either in Denver or in Omaha, and also coordinating seamless follow-up. So for our situation, we're fortunate that we all get along, and there's plenty of business to go around, so there's not a lot of competition. So. But also in terms from a small group perspective, I think networking has been important too. Not only coming to conferences like the IPCU, but also utilizing digital media. Being out kind of more secluded, it kind of helps bring urologists together, especially in the smaller group setting, not only with social media, somewhat Instagram, but mostly Twitter and Facebook. So in terms of currently a moderator for the Thriving Urology Practice Facebook group. This is a private Facebook group that anybody that's in the U.S. that's a urologist, or we have urology practice managers, mid-levels, nurses that can join. It's a group of close to 600 members so far and growing. It was started by Dr. John Lynn, and it's really, and as being a moderator, it's been a good source to bring the urology family together, especially for us smaller groups. We share ideas, discuss coding, really try to work together to improve overall patient care, but also overall patient access too. I'm also a moderator and one of the co-founders of Urologists Only social media Facebook group called Urologists on Social Media. The goal of this group is really to create a platform or a creative space for urologists to increase their social media voices, sharpen their skills, but also collaborate together, share ideas. And it's been a really great place. We just started this about a couple months ago, have over 40 urologists so far, and I think it's been great. And lastly, I'm very excited to announce the launching of the Prostate Health Podcast. So again, as a small urologist, just another avenue to really integrate the stakeholders in healthcare. I'll be working on putting out weekly episodes, interviewing leaders, innovators, and in urology, but really within the broad scope, not only academic urologists, small group urologists, large group urologists, Kaiser, and really with the goal to provide the general public, which this will be based and targeted, the general public with useful information regarding prostate conditions, the conditions that affect the prostate, but also the latest technology in managing these conditions. So thank you.